Good evening to everyone and welcome to today's session. The Junior Doctors Association, which is the voice of the democratic rights of the medical student community, every year gives us a privilege of discussing the wonderful paper. In the recent times I have seen a very optimum, closer to the standards of the actual examiner kind of a paper, which is being conducted by the Telangana JUDA. So, we welcome our online students Manasa, Chandu, Praveen, Kurnool, Guntur, Vizag, across the country. In today's paper, if you crossed 150, we can guarantee you a seat in the ultimate exam. If you are crossing 130 in the Telangana JUDA mock test, you are still in a safe zone on the Lily's curve, is what you have to be, you can be confident upon. So let's make the great beginning. Kiran, Manasa, Chandu, Praveen, Kurnool, can you please punch whether the voice is loud and clear? Is the voice loud and clear for all the online students? I hope so. What is the most medial part of the femoral triangle is a very, very important question. You should remember navel, N-A-V-E-L. L is for lymphatics, from lateral to medial. In the standing position, arterial pressure does not decide the venous return to the heart, is quite a easy question. How is the portal venous system? Do you have the question paper with you? No? You can give to the doctor's question paper. Yeah. Portal venous system. Suddenly, midnight, finally I received the question paper. It is like almost till early morning, 5 o'clock, our team is working to prepare the explanations. So every year we give the paper and the students will do a night out to prepare for it. And today is a very special day of the JUDA exam, that the students, our erstwhile students who are the toppers in entrance, they give the paper and the teacher will do the homework to come prepared. So that is the whole, every year I enjoy discussing the Junior Doctor Association derived question paper. So doctor, portal venous system is completely valveless, is what you need to remember. So what is the most common site for the ectopic pancreatic tissue, doctor? It is in the stomach where you find the ectopic pancreatic tissue. Pudendal nerve, what is the root value? S2, 3, 4. Tomorrow, APPG, TGPG, TNPG, they will all be very, very similar to this kind of simple but at the same time shrewd questions. Now doctor, fatty acid biosynthesis occur in cytosol but not in mitochondria is a very well known fact. So what are purely ketogenic, glycogenic? You must be sure. So it is a leucine which is considered to be the purely ketogenic amino acid. Raj is saying, sir, I got 130 plus in this question paper. What is the prognosis? Very good. Still 2 weeks time is there. So, but the dream score of me for the Raj in the real exam will be 150. Then हम बहुत खुश हो जाएंगे अगर Raj can make it to 150. Shall be the goal, no problem. Still 2 weeks time is there. Now doctor, where do you do Biles test? Purely a quizzical question. Nothing to do with your real time knowledge. Essential pentasuria. Typically, Biles test is a chemical test for the presence of the pentose sugars, and it has been introduced by Manfield Bile, is what need to be remembered. This is a very good question, classical question. Typically phenylketonuria is phenyl hydroxylase and orotic aciduria is OMP decarboxylase and the alkatonuria is homogenesic oxidase and the maple syrup urine disease is branched chain alpha keto acid dehydrogenase deficiency is what you have to basically remember. What is HMP shunt? HMP is purely NADH producing shunt. Directly it does not produce any ATP. It has one irreversible oxidative phase and a reversible non-oxidative phase is what you have to basically remember. I am very happy to see our Kurnool students, one of the most academic students passed out of the Kurnool Medical College. Every year brings us laurels with wonderful ranks. So, which will not change as we keep aging. Hematocrit doesn't change. GFR can diminish glucose intolerance. With every passing year of life, we are becoming closer to diabetes. And blood pressure, as the vessels get hardened, we can't accept the grandson going on a bike. So, as a child, we were fighting to have bike right at the 11th or 12th year of life. Renal blood flow is about 1/4 of the cardiac output is what you have to remember. Heparin stimulates antithrombin 3. In turn, antithrombin 3 inhibits what? Most of the factors of the intrinsic pathway are inhibited. So that is the reason factor 9, factor 10, factor 11, factor 12 classically are inhibited is what you need to remember. Then glucocorticoids, they basically act like anti-inflammatory agents because they prevent the release of the cytokines is what you need to basically remember. Then acrodermatitis enteropathica, zinc deficiency, where hypogonadism, loss of hair, pigmentation, ulcers, decreased immunity, etc., etc. are the features. Whenever there is any aluminium toxicity in a dialyzed patient because of the dialysate contains, dialysing fluid contains aluminium. So, how can you treat it? Basically, the deferoxamine, not only for capturing the iron, it is also used for the aluminium. Excellent MCQ from the the Telangana JUDA paper. Now doctor, which is a proteasome inhibitor? Bortezomib. Bortezomib is a classical example of a proteasome inhibitor. Where will you use it, doctor? Multiple myeloma, mantle cell lymphoma, we use the bortezomib is what you have to basically remember. I wish that AP JUDA also will conduct a similarly a good academic question paper, because first year MD, MS postgraduate students are yesterday's toppers, and the way they select the questions are most similar to what comes in actual exam. So that is the reason it's a good tradition, not just one paper, they need to conduct 4 or 5 papers that will be more or less similar to the examiner's choices. Let me tell you, out of the 200 questions of this paper, at least 60 to 70% same topics questions are going to come. You will find that much a great resemblance is what you need to be very sure about. So the ultimate secret of winning is guessing what is going to come and properly remembering, recalling, reproducing. That made the people become toppers from times immemorial. This question paper reflects the same. 5-HT3 receptor blocker, highest affinity, where do you see? So basically, telenositron ondansetron, granisetron. In the same family, you have pelanosetron. Loading dose depends on what? Pearl-like questions. So, doctor, basically desired peak concentration, volume of distribution, bioavailability, salt fraction. There is a formula for calculating the loading dose. That's the reason loading dose depends upon the volume of distribution is what you have to ultimately remember. Now, doctor, this is a cruel question. Edmonton protocol for the islets transplantation in type 1 diabetes includes what? Basically, any transplantation immunosuppression protocols may, to immunosuppress, we generally use what? Glucocorticoids. But glucocorticoids themselves will lead to glucose intolerance. In case of islets transplantation, if you use glucocorticoids, they found that good, we are able to produce immunosuppression, but at the same time, due to the glucocorticoids, there is glucose intolerance. That is the reason they had gone forward to discover a steroid-free immunosuppressant regime, which is then called Edmonton's protocol from the location where it has been discovered. So it includes tacrolimus, sirolimus, decalizumab. They are all the ones which are basically included. EBV does not lead to verrucous lymphoma, but Burkitt's, nasopharyngeal, Hodgkin's is what you need to remember. Where do you have shortest incubation period out of all? Basically, it is the Staphylococcus aureus, less than 1 to 6 hours is the time, is what you need to remember. Of course, cholera was also given, but cholera, it starts from 2 hours. This starts from 1 hour only, staphylococcal. That's the reason still staphylococcal stands as the is what need to be remembered. That's right. Now, doctor, how is surgical blades, surgical instruments, syringes, everything is sterilized, doctor? They are all sterilized by basically doing gamma radiation. You can see on any INICET, this has been gamma sterilized is what it will be written on the INICET. So that's the reason you don't incinerate, hot air oven or autoclave is what you need to remember. So what is the definitive diagnosis in measles? Fever, rash and Koplik spots are the typical most definitive combination. A 7-year-old is being brought with the complaints of the swelling of the body. They are highly in emphatic gas, no history of hematuria. So basically it is a nephrotic syndrome. So in that there will be no IgG deposits or C3 deposits, unlike a glomerulonephritic picture on renal biopsy is what you have to remember. If apoptosis is there in the options, what is the answer? Apoptosis is the answer. So today's junior doctors, toppers are our essay students. They know the pulse of the examiner and the pulse of our mock test. So apoptosis. So doctor, annexin is a calcium dependent, it has a strong calcium dependent affinity for the phosphatidyl serine, and hence it is used as a probe to detect the presence of the apoptosis is what you have to basically remember. One question on autosomal dominant, autosomal recessive, type of pedigree, any examiner's favorite question. So consanguinity, मामा की बेटी को शादी करे तो क्या होगा? There is an increased chance of a homogeneous genotype rather than heterogeneous genotype is what you have to basically remember. Sanded nuclei appearance of hepatocytes. Where do you come across? Typically this is called sanded nuclei, where you find nuclear inclusions. whenever the hepatitis B is replicating, then the core antigen, whenever it is produced in excess, that lead to the sanded appearance is what you have to basically remember. Dying declaration, one section of forensic medicine is inevitable, whichever the entrance you go. So section 32 of Indian Evidence Act. Lynching is what? Lynching is basically homicidal strangulation, where the entire village will come forward. Unfortunately, they will suspect somebody for sorcery or black magic. Superstition is present across the world, not just in India or in one village or anything. So they kill, homicidal strangulation. Hazardous rule is for the age estimation. Strychnine poison may, you have increased the temperature even after the death does not cool the body. Post-mortem caloricity is seen. The appearance of the stomach is a very, very important clue to what is the possible cause of death. Arsenic poison, the stomach will have red velvet appearance. It is leathery in case of carbolic acid poison. It is corroded and blackened whenever there is corrosive poisoning, the appearance of stomach. What is the most reliable sign on otoscopy, doctor? It is the cone of light, which is considered to be the most reliable sign. What are all the contents of the cerebellopontine angle? You don't have ninth nerve, fifth, seventh, eighth, then anterior-inferior cerebellar artery. They are all the components of the facial nerve, vestibulocochlear, flocculus of the cerebellum, lateral recess of the fourth ventricle, anterior inferior cerebellar artery, ICA. They are all the components of the cerebellopontine angle is what you have to basically remember. Raj is questioning, is it not lateral process of the malleus? Lateral process of the malleus for the earlier question. Most reliable is the word there. So that's the reason cone of light is a very appropriate thing, I think. Huh? Okay, foramina of Breschke. Foramina of Breschke. Where do we see? So basically, on the frontal sinuses, there are venous drainage channels located in the posterior wall of the frontal sinus, which are called foramina of Breschke. If you didn't answer it, no regrets, because you can't guarantee all acronymous names in the entire medical lexicon. So, Quinsted's test. Quinkenstein is different. Quinsted's test. Typically, it is called Tobey-Ayer-Quinked's test. Nizamiya Vulvulum. If you only remember Vulum और निजामिया को भूल गए तो प्रॉब्लम आ जाता. तो वो Tobey-Ayer-Quinsted's test is typically used in the diagnosis of lateral sinus thrombophlebitis, where if at all the lateral sinus is obstructed on one side, then the compression of the jugular vein on the intact side causes a rise of the CSF pressure, is what you have to basically remember. Beautiful question, this one. I had been waiting for this question since long time, though it is a previous question, but still the best pick among the previous questions. Symptom होता है unilateral hearing loss. Clinical sign होता है the reduced corneal reflex, because the fifth is the earliest nerve to be involved whenever acoustic neuroma is there, is what you have to basically remember. There are various signs in the glomus tumor. So what is your answer, doctor, for this question? Blanching of a mass with the manual compression of the ipsilateral carotid artery. Come on. Kuch guess maro. Question number 39. What the answer of the online students? Let me check. Yes. What is your favorite right or wrong answer? Chandu is proposing equino. Absolutely. Phelp is loss of the crust of the bone between carotid canal and jugular canal in case of glomus jugulare. Then Brown says the pulsation positivity, and Equino says the blanching of the tympanic mass with gentle pressure on the carotid. And Brown says pulsation affected by the pneumatic compression that is abolished with further compression is basically called Brown sign. What is Schluder's neuralgia is a very important question. So basically it is the middle turbinate pressing on the nasal septum is the underlying cause for the typical headache the patients get in case of Schluder's neuralgia. Luttenschlager's operation, where do you basically come across? I'll give you one more clue. Young's operation, where will you do? Atrophic rhinitis, the same thing. So Luttenschlager's aimed at medializing the lateral nasal wall. Young's operation is the closure of the nostril following elevation of the nasal vestibular folds for the Ozena, atrophic rhinitis. This is another, probably the question frame may something else need to be included. 40 decibels compared to 20 decibels is how much more in loudness should be the correct word. Then the answer will perfectly fit as 100 times. Why? A decibel is a logarithmic unit of measurement. So 20 से 40 कितना ज़्यादा है? 2. So it is 10 to the power of 2, which is 100 times, right? Not 2x, rather 100 times. So one question on Ishiki thyroplasty. So type 1 means medialization thyroplasty, type 2 means lateralization. Yesterday only you had a class. Oh, very good. How was the class? ENT? Good, manageable. No. Are you able to sit for about 4 or 5 hours and can attend? I know you are very studious and now you are in a antepartum phase, ready to deliver for the entrance exam. So your receptive level of the brain is very high. But general rule is all or none among teachers. If a teacher is good, he is good. If he is bad, no chance of improvement. Like singers. सुरदास है तो सुरदास होगा, बेसुरदास है तो बेसुरदास ही होगा. ये वो नहीं बन सकता, वो ये नहीं बन सकता. So that's the reason I thought of taking a direct feedback. But the teacher is younger, he is well prepared, more recent in knowledge. Earlier we had Dr. Srinivas Murthy, my very good friend, Dil ka friend. Most of the friends are very good friends of me. I don't make anybody lose, but unfortunately he passed away on a road accident, which is a great loss for the students. Many batches he taught ENT. So we are trying to find a replacement, so that's the reason. So you are happy today, once more evening class is there. So mainly you need to get some 40 topics, 400 points, ENT. वो 400 पॉइंट्स अगर कानों में चल गए तो, घुस गए तो एग्जाम में मिनिमम 70%, 7 out of 10 marks you can answer. And if you do that in ENT, you are winning the exam. Lakshminarayana says 4 to 5 hours of ENT is not getting into my sinuses appropriately. So, but the point is exam going, no, you are all EG, PG, exam going, postgraduate entering students. Then intraocular retinoblastoma. Classically, even in sporadic retinoblastoma, they can very much pass in about 1/4 of cases. Though the parent got sporadically, still he will inherit that to the next generation in about 25%. Two types, sporadic, heritable, right? Grandfather is a agricultural farmer, daddy is a surgeon, grandson also becomes surgeon, kitte chances hai? If the grandfather is doctor, father is doctor, means that is heritable. Grandfather is farmer, daddy is a doctor, what is the chance of grandson? That is what we are asking. Sporadically he became doctor, no family history, but his son becoming doctor is like 1/4. Similar, I am telling you to understand retinoblastoma. So calcification is a very, very important feature which you have to basically identify. Even on ultrasound, you can see the calcification in case of retinoblastoma. Ardens index is for the interpretation of what? Typically, it is for the electrooculogram, we use the Ardens index. A 18-year-old, it's a previous MCQ from All India entrance, but a very good MCQ. On examination, there is hyphema. What is the source of hyphema? It is circulus iridis major, which will be giving rise to the bleeding. This is the very interesting question. 25-year-old male, sudden painless loss of vision in one eye for the past 2 weeks. Painless loss of vision. So, how should be your differential diagnosis? If it is optic atrophy, it will be painless but gradual loss. If it is developmental cataract, it is painless but also gradual loss. If it is acute attack of angle closure glaucoma, it will be painful but sudden loss. In vitreous hemorrhage, it is painless and sudden loss. That is how you need to basically identify. Now doctor, Horner syndrome में cycloplegia नहीं होगा, मगर ptosis, anophthalmos, meiosis, they are all the important features. Gentamicin, if you give intravitreally, it can lead to the development of macular toxicity. Is a very well-known old question. Subluxation of the lens में what is the rule? Marfan में upward outward. Marfan बहुत लंबा होता है ना, upward outward. और homocystinuria will be downward inward. अगर excess homocysteine है तो heart attack आएगा, heart attack है तो graveyard में जाएगा. Graveyard बोले तो नीचे रहता ना. So remember, downwards and inwards is what you can remember. Safe is for the trachoma. Recurrent chalagion, if it is there, you will suspect the possibility of a sebaceous cell carcinoma, especially in an elderly person. Oh, this is a beautiful question. Definitely this can come straight in the tomorrow's entrance. Food safety. Annam parabrahma swarupam. So food is the reflection of the divinity. Where is the God? Means God is in food. So that is the reason World Health Organization also said the food safety is the 2015 slogan. Every year one WHO slogan, high chance of happening in the entrance exam. Anopheles Aedes Culex mansoni. So all of this, so it is filaria which is capable, filariasis. Who trains Asha? Definitely one question will be there on Asha. So it is the Anganwadi worker and ANM. At least our primary health center doctors must answer it correctly. Pakka? Huh? Sure? Okay. Anganwadi worker in because they spend lot of money in training the PHC doctors about these basic funda. Dots in tuberculosis, revised national tuberculosis program. There is some special advantage when you are preparing for entrance exam in service quota. So at least your own questions you should not miss. And of course, if you have, if you are a service doctor, there is also advantage that your clinical skills are much more evolved because you had been seeing cases every day more abundantly than a newly preparing housey. So that's the reason always you should look what are the positive aspects of possibilities of winning entrance exam. So now doctor, incubation period, measles, hepatitis B, pertussis, they all can be transmitted during the incubation period. Luckily tuberculosis is not so. Then what is meant by design effect in which type of sampling technique design effect is associated? I'll tell you what is design effect. We see it in cluster sampling. The design effect is an adjustment which is being used in cluster sampling methods. So there are some standard errors which are carried by every parameter associated with a sample. If you take a sample size, what are the various parameters which can be associated? Age, sex, weight, race, so many nutritional type. So any given cluster has so many variates attached to that. So they themselves can affect the nature of the sample. So for that you need to do some sort of shanti, and that is basically called the design effect. Depending upon what type of cluster variates are present in that given cluster is basically called the design effect. Then which infect did not develop resistance to DDT? Sandflies, Glossina palpalis. So resistant to DDT is not identified in the sandflies, whereas all the other vectors have developed the resistance to DDT. Aflatoxin is produced by Aspergillus flavus and Parasiticus but not fumigators. This is another repeated question from the DNB exam, but still a very good pick among the questions. A good mock test means what? Good picks among the AIIMS All India PGI state entrance exams and then putting it and 10-20 new questions. So that will constitute a very good mock test. Without swine flu, अगर तेलंगाना postgraduate entrance में question आए तो examiner will lose his portfolio. So that is the reason, doctor, anything about swine flu, you have to be 100% sure about. Okay. So the last 1 week I had been running pillar to post to get oseltamivir. My child had fever. Fever in epidemic of swine flu is considered to be swine flu. So unrelenting, severe cough. So no medical shops will give it, and they need a prescription. So luckily one of my, I was just wondering who will give me a prescription at this hour. So luckily is given in the government hospital. So that's the reason, doctor, 4 ml per kg. If the weight is between 23 to 45 kgs, it will be each ml contains 12 mg. So 4 ml is 48 mg twice daily. You need to give. Prophylactically means only once daily. So generally symptoms are divided into A, B, C types. If respiratory distress is developing, you call B. Severe respiratory distress, C. But being a doctor, we can't wait until distress comes, no. That is a whole problem. So the guideline of WHO says distress aane ke baad de do because that is the only drug available to save the B and C group. But if your child is in A group and you are a doctor father, you will develop distress first. All B and C symptoms you will be developing. So that is a whole challenge. Incubation period of swine flu is around 1 to 7 days is what need to be remembered. Who discovered and coined the term vaccine? Vaccine. So it is the Louis Pasteur who need to be basically remembered. What are the most logical sequence out of this, doctor? First is disease, next is impairment, then disability, then handicap. Handicap. The moment you lose that occupational income, that becomes a disability, and social element is added up, that becomes so different definitions of each of this. You need to remember, maize may you have got leucine in excess and deficiency of lysine and tryptophan is what you need to remember. A nurse was given an appendix in the operation as a gift for helping the surgeon. In which bag she should throw? So one bag ke bina examiner will not be happy. So yellow bag. Once more same things will happen in the state MD entrance, doctor. Which category, which color bag, which cylinder, which type, what is the pin index of the cylinders. If you plead, I am not yet ready for all this, examiner will say, will not have any courtesy, competition will crush you down. So don't forget, anatomical base are plastic bag, animal base are all category 2, biotechnology base are 3. Very favorite question of the examiner is incineration as. A lot of times that would be black is what you need to remember. PERT is a technique of what, doctor? Network analysis, program evaluation, review technique it is basically called as. If there are 5 independent factors which are deciding the outcome of the occurrence of a disease, then what type of analysis will you use? Multiple linear regression. Now let us look into definitions of each of them. In multiple linear regression there is one dependent and multiple independent variables. Being a married PG preparing aspirant, chances of getting seat. Being a government doctor, chances of getting seat. Being married with 2 children, chances of getting seat. Right? So, being single but depressed that nobody is available as a partner, what is the chance of getting seat? So, getting seat every time is what? Dependent variable. So, being married or not, being public servant or not, being unmarried or not, did you have an application in Shadi.com with no responses coming or responses coming? They are all what? Independent variables. In that scenario, ultimate getting seat, which is the dependent variable, is dependent on multiple factors. Then you use the multiple linear regression. Then what is meant by logistic regression? Logistic regression. There is one factor. If that factor is present, there are 2 possible outcomes. सीट मिलेगा या नहीं मिलेगा, अगर मिल गए तो शादी होगा या नहीं होगा, अगर शादी हुए तो बच्चे पैदा होगा या नहीं होगा, अगर पैदा हुए तो वो विदाउट कंजेनिटल एनॉमलीज होगा या नहीं होगा, अगर है तो कंजेनिटली नॉर्मल है तो उसको पढ़ाई में दिलचस्पी होगा या नहीं होगा. सो लाइफ इज ऑल ए बिग चेन ऑफ अगर ये हुआ तो वो होगा या नहीं होगा. So in that scenario you use the logistic regression. Then what is ANOVA, which is analysis of variance? Yeah, I think Sri is asking, why not ANOVA, sir? Basically you have, instead of two groups, multiple groups. Every group has a mean value. For example, BP in first year MBBS students mean value, second year MBBS versus assistant professors group versus additional professors group. 4 different groups you took and a mean BP value you calculated and wanted to compare between multiple groups mean value. Then you will be using what you call analysis of variance to know the difference between the group means is basically ANOVA. Anyway, you know what is meant by chi-square. What is the most effective method? What is the most effective method for a couple who want to adopt a family planning practice? Interpersonal communication. Chai par charcha. Chai par charcha hona hi padega. So that is what you have to do whenever a couple have to decide on which apartment to buy, how many children to have, which school they need to go, which refrigerator is good, whether it is LED or LCD TV. All life is full of decisions, na? So that is what you need to be sure about. Pyridoxine deficiency is basically neonatal seizures. Neonatal seizures.